Hello, and welcome to another interview in the ACM-W and CCI series celebrating Women's History Month. We are talking with alumni and executives about their perspectives and exploring the UN International Women's Day theme of gender equality today for a sustainable tomorrow. My name is Nadia Najjar, faculty member at the College of Computing Informatics and ACM-W faculty advisor and a proud alumni. We are excited to welcome Angela Yochem, EVP and Chief Transformation Officer at Novant Health, a Charlotte area healthcare provider focused on the health of our communities one person at a time. Angela, welcome, and we are thrilled to have you with us.
Thank you. I'm always happy to speak to the students at UNC Charlotte.
All right, Angela, thinking about the theme, gender equality today for a sustainable tomorrow, what does gender equality mean for you personally and your role as an IT executive? And does it shape the way you think about your work you do?
So the thing that's important to understand is that anytime we have to solve a difficult problem, we're going to likely come up with a better solution if we are collaborating with a diverse group of thinkers. We want diversity of thought. It's very difficult to measure diversity of thought. So we have to measure diversity of experience, right? And it's clear, I think, to all of us here that one's gender identity certainly informs one's life experience. So if we have a diversity of genders represented on our teams, then it stands to reason that the solutions those teams develop will end up being a higher quality as a whole than those that have less diversity. So when I think about running large teams, whether they be IT teams, larger business operational teams, it's important to make sure that we are not inadvertently structuring those teams and or those the processes and the routines that we use inside of those teams such that it favors just one gender. Now, unfortunately, you know, in the past, our society has in fact set up a number of just practices that have historically favored one gender. And it's just important in today's world that we don't do that. We don't inadvertently fall back on old habits, old routines, and disenfranchise some of the greatest minds that our society has to offer by not allowing them to participate and not allowing them to participate to the fullest of the extent of their abilities. So it's just important to be cognizant and to be intentional in how we set up our management routines in any sort of organization.
Absolutely. So this is something that we at CCI also are very proud of, is our diversity. I think there's a tremendous strength that comes with that. Great. Mm-hmm. Absolutely. All right. So soon at the end of every semester, you know, we have students that will be entering the workforce and considering all types of organizations. So what should other IT leaders do to promote further equity? Or put another way, what should our students look for in an employer when it comes to gender equality?
So I think it is fair to today for job applicants to ask questions about the diversity of the teams that they would potentially be joining. You know, so if you're in, and that's true, by the way, I'm speaking to everyone when I say that. You know, if you are a white male, cis male person, still ask the same question. Ask the question, how do you think about diverse teams in your organization? How diverse are your teams? How do you think about promoting diversity of thought? How many women do you have in your senior staff? How many, what is the percentage of female, what is the percentage of non-male team members across the board? How do you personally think about building a diverse and inclusive culture? These are important for everyone these are questions that the answers to which are very important for everyone to understand. If you're going into a new workplace, you're going to be spending so much of your time there. These are the people from whom you're going to be learning. You're going to be picking up the very earliest professional experiences from these people, and you need to understand what's important to them. you certainly don't want to get in there and find out that you've aligned yourself, perhaps inadvertently, with people who, who kind of like the way things have always been and have no intention of seeing anything change. Because the world is changing around us. And if the teams are not prepared to change, and the culture of the organization is not prepared to change as the world changes, then they're not going to be successful. And you're going to be joining a ship that's about to sink. So it's all tied. Business success, differentiating in an increasingly complex competitive environment, regardless of the industry you're considering joining. It's all going to be dependent upon some of these key questions that you can ask going into that first interview.
That's great advice. Thank you. All right. So sustainability has been a consistent topic in many of the conversations we have had recently. And thinking about the second half of our theme, what does a sustainable tomorrow mean for you? And what action do you think we need to be taken personally or organizationally to get there?
Sustainability is not only something that we think about in terms of societal health. Sustainability is something that is of great interest to the governance bodies that look after how companies are making investments and what decisions they're making as they build partnerships to succeed in their given industries. And what I mean by that, if that terminology didn't sound familiar to you, you of course are familiar that many organizations are governed by a board of directors, and those directors are meant to represent stakeholder or shareholder interests. And so when we think about the sustainability elements, they're often called stakeholder incentives. And they are not just about, when we think about sustainability, it's not just about environmental factors. Environmental factors, extraordinarily important. For example, I have the privilege of serving on the board of a large property and casualty insurance company. And, floods and storms and climate change does in fact result in, damage to property that is insured by this company. So, it is not just about being, a great citizen of the world to address environmental issues. It's also good business to address environmental issues. And so, environment's always top of mind, and that's very important. But there are also social issues that, certainly have been top of mind for everyone. Thank goodness in the last couple of years, better late than never, right? Where we think a lot about not just making sure our team members are, have the training they need and have the opportunities they need, but also that they feel safe in their workplace. Also that they feel like their workplace is contributing to a better community, the community in which they operate. These are important things to the team members who are part of our company. Therefore, our company won't be successful unless those team members feel as if the work they're doing for us is in service to those things that they believe are important. So that's another stakeholder interest example. There are community components associated with stakeholder interests. And again, these are traceable not just to what is the right thing to do as a good, decent human being running a company. It's about, what is going to make your company successful and be able to continue to thrive and make money, do good, have fun, but you have to make money to keep the doors open, right? So the money-making piece flows from the ability to understand what sustainability and other stakeholder interests are and how they impact your business. So it's a broad focus area. There are entire professions around managing this, risk management. Everyone should have a chief risk officer. Everyone should have a risk management program inside of their operating teams. And certainly your boards are going to be paying very close attention to how you're managing risk. And Nadia, that's actually a great thing to also ask as someone who's coming into a new job after graduation or perhaps before graduation. Ask about how they think about risk and how the group you're about to join helps manage the risk for the company. And if they respond and say, well, risk management is part of, it's actually under legal and their risk managers. You can say, I mean, that tells you something. That means that there is no clear connecting of dots between overarching risk management and the group that you're considering to join. Another great question would be, how does our group support growth of the company? And again, if the person who's considering hiring you can't connect the dots between the work that you would be doing and the company's growth or success, that may be a problem as well. But no, thank you for that question. I know it's quite a broad topic, but I'm glad you think along those lines.
Yeah, thank you. And thank you for linking it back to kind of our students and what kind of advice they need to be, thinking about as they're entering the workforce. And it's really important to also kind of think of any organization you try to join that is part of a community, not just focused on itself and just kind of sits in its own bubble and its own concerns and needs. So for sure, thank you for that. All right. So what is that that you are most excited about for you and your team as you look to the, forward to the next 12 months?
I had the pleasure of serving with some absolutely phenomenal human beings. Our team is a very diverse, distributed organization of technologists, of clinicians, of operators. We have about 1,000 team members and 200 or 300 contractors that are part of my team. We are based, like I said, we're distributed, so we're all over the place, but big hubs are, here in the Charlotte area, over in the Winston-Salem area, over on the coast in Wilmington. And then we have people distributed around, the entire country, but primarily the Southeastern US. The competencies that we've built are directly impacting a couple of things that are very important to our communities. Number one, we provide expanded access to care. So when you think about health, I mean, that's kind of, you don't have anything, when you have a health issue, you want that to be addressed immediately, right? But there are so many people in our communities that don't have easy access to care. And there are many, many people who have great insurance and living a life of privilege, and they still don't have access to care because they work all the time. So it's just not easy for them to take time off and get into to get something checked out. And we want every single person in our communities, the communities we serve, to achieve what we call health equity. And health equity is the notion of each person being as healthy as they possibly can be. And it all starts with access to care. If they don't have access to care, that's a problem. So my teams are responsible, one of the many responsibility areas for providing access to care through virtual channels and through unconventional channels, so non-traditional channels of care. So can you walk into a retail location and get care? Yes, we provide that level of access. Can you walk into your living room and get care? Yes, you can. And not just because, you can have a phone-based video visit, although certainly that's available on demand all the time. But also we have advanced sensor devices, devices that have advanced sensor capability that allow us to, look in your ears and down your throat and up your nose and in your eyes and take your temperature and listen to your heartbeat, take your blood pressure and listen to your lungs. These are things that would be automatically uploaded into your medical record and seen by your care team, either in real time if you're speaking to someone at that moment, or perhaps, whenever if it's 10 o'clock at night and you don't want to talk to someone, you just want to enter that information into your record, then come in and do it the next day. So these are the sorts of things that we have been doing to make it very, very easy to collect vitals and have a meaningful visit and a potential faster diagnosis for our patients. The second thing we do to promote health equity is we always want to improve the quality of care. So there are so many things that we're able to do that are difficult for other systems. One thing, for example, we are able to predict major health events before they happen for our patients. Not every single major health event, but a lot of them, a lot of the most common health events, the most common killers, we can predict a lot of that before it happens to you as a patient. And we can react and proactively reach out to you. This is true for things like heart health events. We can predict the likelihood of an attempted suicide upon discharge from our emergency department for a behavioral health, mental health patient. We can predict the likelihood of breast cancer in the next 4 to 5 years based on the results of your mammogram. I mean, these are all based on the proliferation of data that is now available to us. And of course, the advanced computing capabilities that are available to us. So now we can build models and apply true AI-based solutions that allow us to make these predictions and be very prescriptive with follow-up and treatments for the preventative treatments for the patients. So these are the sorts of things, and that's a very simple example. There are so many significant examples that are behind us in the rearview mirror that we've already done, and the things that we're going to do are almost science fiction sounding things. So what gets me out of bed? I mean, I'm a geek, and even though my responsibility areas far span well beyond that sort of geeky stuff, the way in which we're changing the world and changing people's lives, it's phenomenal. It's an amazing experience for anyone who wants to make a difference.
Absolutely, thank you. And let me just go off of script here a little bit, just follow up on some of the comments that you mentioned in your response about data, right? Like in building models. Can you speak a little bit about how you ensure that these models are equitable? That there's the thought of bias in data that collected in order to generate some of these kind of AI or drive the AI models. Is there any kind of effort at Novant or in your organization that kind of takes that into consideration?
It's an excellent question, and it's important to look at this from a couple of different perspectives. First, there's this notion of governance, where we routinely review all the things that are happening. Our data scientists are doing and generating and developing, questions that are being asked and they're asking themselves are being reviewed from on high, in the sense that it's a cross-functional governance body that allows us to look and ask the right questions and pressure test assumptions and all of those sorts of things. So that's one way. The second way is ensuring that the people who are, hands-on keyboard, so to speak, are extraordinarily cognizant of potential bias. Healthcare, like every other industry, has a history of some degree of bias and assumption. We see it in medical research all the time. I mean, it wasn't until I want to say the 90s that there was any significant research for women's heart health, by the way. All research up to that point had been on men's heart health. And just assumed a heart is a heart is a heart is a heart. And if you were born a female, regardless of your gender identity, you have a very different type of risk factor than someone who is born a male has for heart disease. And we know that now because the research now exists. It is important that we in healthcare, as well as anyone in any industry, is, again, very intentional about making sure that people who have hands on keyboards are cognizant of historic bias and ensure that the historic bias no longer exists in any of the decisions that are being made. So it's a top-down governance, and it's a bottom-up awareness and intentionality from every member of our team.
Great. And as you mentioned, yeah, the healthcare field is definitely a challenging one, especially for this problem, right? Like, because, some of these kind of characteristics are actually do play a difference, and we need to sometimes look at them, in isolation versus actually having the same representation, let's say, in the data set, but absolutely. All right, so just kind of wrap up. And as you all know, the hard work begins at home. So how can the College of Computing and Informatics partner with the community, including your organization, to achieve gender equality for a sustainable tomorrow?
I think it's a two-way street, right? So on one hand, the College of Computing and Informatics serves the entities in our community in a couple of extraordinarily important ways. Number one, you create a talent pipeline for us to compete in this extraordinarily rapid, fast-moving business environment in which we're all operating. So your talent coming out of your college and the expertise that your students possess will be our key to differentiation and the key to ultimate societal change for good over time. So that in and of itself is a tremendous service to us. The second thing that you provide as part of your as part of your just standard operating model is the research that you do. The undergraduate research that you allow in your college, as well as the graduate and faculty research areas are so tremendously interesting to us. When we think about ways in which we can shortcut or short circuit certain lengthy processes that are highly manual. A lot of the things that you are doing right now in CCI are things that can be applied to cut out, unnecessary time, unnecessary work, leveraging the advances that are happening in technology. So I think that research institution status, that robust undergraduate and graduate student pipeline that you provide is just tremendous. The other thing you can do, sort of in the non-traditional sense, is you can challenge the business community because of the importance that you play in our community. You are coming from a position of power, and your university, your institution, can challenge the business community to make sure that we are focused on building up your institution that is the heartbeat of our city, such that you continue to have opportunity to grow and research and apply that tremendous talent. You are our hometown university, right? This is everything that we do, and as we think about talent and expansion of talent, should be the first call we make should be to your dean and to your chancellor, right? I mean that's who we should be calling, and I think that challenge is an important one for Charlotte to make to the broader community.
So thank you for that advice, and we'll definitely take it to heart. And thank you, Angela, for this opportunity to come sit down with us and talk. Your advice, your insight is tremendously valuable, and we appreciate your taking your time.
Oh, anytime. I'm so pleased to have been asked.
Thank you so much.